Hi, Dr. Melissa.
Hello, thank you for having me today.
Thank you. Thank you for being here with us today too. We are truly honored to have you for this interview. Hence, to begin, here are some questions we would like to cover. What are the emotional reactions and challenges that patients and their loved ones may face during the breast cancer journey?
Whenever a patient receives a bad news, like a diagnosis of breast cancer, they go through stages of grief. They don't go through all the stages of grief, nor they experience all the stages of grief in any particular order. There are 5 plus 2 stages of grief. The first 5 are denial or shock, anger, bargaining, acceptance, depression or anxiety. 50% of breast cancer patients experience depression or anxiety. The other 2 stages of grief, like reflection and emotional healing. Reflection is when a patient reflects on the impact of breast cancer diagnosis and treatment upon their physical, psychosocial, sexual, financial and mental well-being. Emotional healing is when a patient recovered from their treatment and learn how to live well beyond the diagnosis and treatment of breast cancer.
So what advice do you have for patients on how to cope the shock and fear from a breast cancer diagnosis?
It's obviously normal to feel that way, but as a breast surgeon, I need to ensure that I educate patients with the facts of their diagnosis, make them understand the importance of the treatment that they will be receiving, encourage them to seek help from others, their loved ones, friends and family, and also empower them to be resilient, to face the challenges ahead. But it's okay not to be okay.
So doctor, I would like to ask, how do you approach the topic of potential breast loss or reconstruction with your patients?
I must take this opportunity to highlight that with increasing breast cancer awareness and breast screening, we are able to detect cancer earlier. Early stages of breast cancer are highly treatable with excellent outcomes. In my experience, only 30 to 40% of patients would lose their breast. If patients need removal of breast as part of their breast cancer journey, which is called mastectomy, then I would offer them simple mastectomy with no reconstruction, mastectomy with breast implant reconstruction, or mastectomy with using their own tissue as a form of reconstruction, often called as autologous breast reconstruction. These can be done in an immediate or in a delayed setting. Whenever they are concerned, I would also show them pre and post-op photos, show them the indication, benefits, side effects, risks and complications for each and every procedures that are available for them. That way they can have time to digest and reflect and even go home and discuss with their loved ones before they come back and give me a decision. A decision commit to breast reconstruction is a big one, and it's not an easy decision to be made.
Are there any support groups or resources you can recommend for the breast cancer patients during this emotional journey?
I would provide them relevant information leaflets, trusted online material or books that they can read. In terms of being physically within a support group, then they could look out for where they live, because nowadays with increasing breast awareness, there are many pockets of community charity support groups that they can join and get that extra support. Nowadays with Wi-Fi and the internet, we could even reach out to people outside of Malaysia. I know a breast surgeon whom was diagnosed with breast cancer in the UK in her 40s. She often used social media to get social supports from people all over the world. And that way they really can form a strong network, not just in person, but virtually.
How can family and friends best support someone undergoing breast loss?
Whenever removal of breast or mastectomy is the best surgical option, it's often because that is the safest option, or a patient chooses to lose their breast. As a breast surgeon, I always encourage patients to attend clinic with their trusted loved ones. Often their husband or partner, sister, mother, or even a best friend. That way they can hear the same information from the same person, and they can go home and discuss about the treatment. It is also important that their trusted loved ones offer help from practical side and from emotional aspect. Practical side, like I've mentioned, coming to clinic with themselves, doing errands for them, making meals, continuing doing things that they like doing together. Or from emotional aspect is to send them a text just to say that they're thinking about them, letting them know that whenever they need someone to talk to, they are just there for them. But at the same time, respect the patient's privacy and let them know they're not alone.
Can you share a short message of hope and encouragement for breast cancer patients and their loved ones too?
I've been practicing as a consultant surgeon for the last 5 years, just before I returned to Malaysia to Prince Court Medical Centre. One of my nurses used to tell me, "I've seen you cry and laugh with your patients," but more importantly, she saw more beaming smiles with hope on their faces. This is because we have far more survivors than breast cancer patients dying at any one time. I have 3 messages for ladies out there. Please be breast aware, examine your own breast once a month, lead a healthy lifestyle, and attend your breast screening, because early detection means highly treatable with an excellent outcome. For those ladies whom had been diagnosed with breast cancer, embrace your normal self, live well and beyond your diagnosis. So what I mean by healthy lifestyle is protected with your SHIELD, an acronym SHIELD, S, sleep. Some say we must at least have 6 to 8 hours of well-rested sleep. H, handle stress with effective strategies. Do yoga, meditation, practice mindfulness. I, interact and engage in meaningful discussions. Network and form strong relationships with each other. E, exercise, be active and engage in social activities. L, learn to love ourselves so that we can give more love to others, or perhaps learn a new thing. D, of course, diet, low fat and sugar, but high fruits and vegetables diet.
It was indeed an insightful information that you have shared, Doctor. We are really truly grateful and also honored to have you for this interview. Thank you so much, Dr. Melissa, for having this together with us.
Thank you so much for having me. Interview, and his wife, his second wife, is 25 years younger than him. Of course, I didn't add like have a young partner.